them. Now, you're going to see different things. Now, I put something in there called an ADPI. And an ADPI, I want you to think about it when you think of scenarios, the way you look at children, adults, doesn't matter. When you look at a patient you want to take care of, that assessment, what do you see? When you look at a child and you see them, a little infant flaring and grunting, what does that mean for you? And that's going to make your nursing diagnosis. And then figure out, now, what do I need to do? But what do I do first? What is your priority treatment? And what other interventions? And then always, did it work? Did it work? Go back and evaluate it. And it could be as simple as, elevating the head of the bed, putting on some oxygen, okay? And those could be it. And what happened? Patient is breathing easier, not flaring anymore. And that's, or just we gave Tylenol and now the fever is normal. So it could be a simple little nursing outcome, your evaluation, but every intervention you do as a nurse, there will be an outcome, and it could be no outcome, or it could be patient looks better. Color of skin improved, breathing, respirations decreased. You can see a lot of things. So anyway, I put that there to help you because Med-Surg 2, pediatrics, you're at a higher level of Med-Surg and understanding. So I hope that sometimes when you look at an NCLEX question and it talks about, let's say, hypothyroidism, first you got to sit back and think, what is hypothyroidism? Then read the question, what symptoms are showing? And then you can determine these answers just by ADPI. And I had many patients tell me that using the ADPI does help in the answering of questions. So always remember that as you're doing your home NCLEX questions. Now I want to warn you, some of you, now I've given you the open NCLEX that you can have them. Remember, you have to have 2 points of entry into Canvas every single week. Sometimes if you submit early, you may not have 2 points of reference. So be careful. Maybe like resubmit them the week again, just to show it, okay? Any of you who have worked ahead, I don't want anybody caught. This week, you're going to see that I did post something on Saturday regarding that there were some students, like over 100, that had not signed their attestation, which all you had was discussion question and attestation. That's your 2 points for this week. So some of you didn't do attestation. So I went back, send you messages, and within hours they were done. So if it was any of you, thank you so much. I like the quick responses because I don't send out messages unless they're important. I'm not one that's going to give you 100 ones every week. I don't believe in it. Only what's due. Oh, but I do apologize. You did get your information twice this week. I thought I was in another class already. So, all right, so you have double week 2 info. Attached to your week 2, week 3 will always be your PowerPoint for the week. So you do have those, okay? So today, what are we going to do? Well, first of all, let's look at the assignments. This week you have quiz 1, which I've said, and you should wait till after class to get it done. And with week 1, make sure that you have your stages of Erikson, Piaget with you, okay? I'll give you a little hint there. And you have discussion question 2. Also, you will notice that your burn case study is open if you want to work ahead, okay? Remember, only go through the module. Do not try to go through Evolve because you will get a 0 and you cannot redo it. And there's nothing I can do. I can't reset it, okay? All right, today, we're going to be doing a great class. It's all infants. It's going to be your toddlers and your preschoolers. I think this is my favorite age of children. I think this is when they start to explore. And I'm going to try to describe these theorists and make them understandable as we go through it, okay? So let's start with our PowerPoint. And I have a 55 question Kahoot. Now, remember, and I have redone it again, looking at HESI, looking at exams, looking at information I'm getting regarding your NCLEX. I'm trying to make sure those concepts are covered. So again, these Kahoots are redone every semester to help you succeed in all of these 3 areas, okay? Another question I was getting is if I'm going to hand out study guides or reviews. I do reviews on week 3. You will get the schedule usually by Thursday or Friday of this week, because next week is week 3. You also will get the PowerPoint that's attached to that, okay? And I usually myself will go through and make sure that PowerPoint is with all those concepts that you are going to see on the exam. Now, should that be the only thing you study? No. Okay, if you're not understanding what the PowerPoint is trying to tell you, go open your book and look at it, okay? Also, go back and look at your Kahoots. Those concepts, if you don't know them, you could stop the Kahoots and go and look it up in the book so that you understand not only what it is, but how do you apply it to a patient, okay? So let's start with our PowerPoint, and then we are going to go to the Kahoots. And it is a good Kahoots today, though it is longer. So slideshow, and I am on record. If I forget to put on record, could you all promise me that you'll remind me so that I do have it on there? Okay. I have gone and had students stop me, and I really appreciate it. So let's start first. Here we go. Growth and development, those milestones. We're going to go infant, and we're going to go to preschoolers today. So infants, I think infants are precious. And we know that infants, oh, this is going to do this again. I have one PowerPoint that tends to like to go for me, go too quick. Okay, I think we got it. It just would just move by itself. There it is, it's doing it. Well, hold on. Let me see if I can stop this from doing it. And if any of you can help me with it, it's under transitions. Anybody a PowerPoint guru? Transmissions and advance.
The duration.
And put it to what? This one's, you see? 1 second, there's something over here. None. I think that's it. I think that's it. Okay, and duration is auto now. That is it.
Unclick the after, we'll go back to transitions.
Yes, ma'am.
And then advanced slide there.
Beautiful. Thank you for your help. You see, you're that generation that understands this stuff better than me, so I appreciate it a lot. I learn every semester something from you all, so thank you. Okay, here we go. Thank you. So growth and development, growing, infants. I mean, you start with these precious tiny little babies that, you know, are from anywhere from 1 pound to, I've seen a 16-pound baby was my biggest that I've seen in my career. Boy, was that a big boy. And it was a vaginal delivery, believe it or not. They go through so many changes. They grow quickly. Their brains grow, their lungs, their GI system, their reflexes, the central nervous system. They go from not being able to hold their head up to the end of the first year, they're standing up and many of them are running just down the hall. You have to chase them. So that's amazing. 1 year, that's all it took. I mean, it takes me a year how to get up the endurance, you know, to get up to my 20 laps in the pool, you know, but these children move really, really quick. So what do we know about the infants? Initially, they are born and they'll lose about 10% of the body weight. That's just a normal newborn thing because they're floating in water. So they have water saturation. So after that, they gain their weight back and it's 5 to 7 ounces per week. And we've already covered it, you know, in the Kahoots, but its birth weight is doubled by 6 months, tripled their birth weight by 1 year, and they get taller and taller. I don't go into you understanding how they get taller, how many inches, how many feet per each developmental. I think the biggest thing is as we are getting older in the toddlers, just to know that gaining weight and also getting taller is part of it. We know these infants, you tend to see infants, they'll get all of a sudden looking pudgy and all of a sudden they're longer. Then they get pudgy and they get a little bit taller. So I call it's a step stair. You know, it's like they plateau a little bit and they gain a little weight and all of a sudden they're going to spurt up and they'll get thinner. And you can see this all through childhood. You see it in infancy also. So as we get older, Now I sent you the vital signs. You're going to see those vital signs start coming down and down and down, where the heart rate, see the thing is going again. If it doesn't bother you, just don't look at it. You're going to see their heart rate going down and the respiratory rate coming down. But the one thing that we don't realize is when the babies are born, they're born with the red blood cells from mom. And those cells, what mom has given them, tend to go away after a while. They're not there. So you will see infants that their hemoglobins and hematocrits can be all the way down to 7 and 21. And as long as they're not symptomatic with that, we are actually okay with it. But they don't start what we call making their own cells, reticulating their cells at birth. It takes about 6 months before we start to see that. Another thing is we know that these infants are born with mom's immune system. So it doesn't last. That's why if you've done any reading in your book, you're going to see immunizations given at 2 months, 4 months, 6 months. And those immunizations are trying to cover that infant for those big diseases. So if we have an infant who's very young, that's younger than those first 2-month injections as immunizations, we are going to be on high alert, and we're going to really treat those children, because those children are have no immune defense at all, only what mom's given them, and it's going away. Let me see if I can figure this out again for y'all, because it is annoying. So none, take it off. Let's see if I have to do it.
If you go to animations, if you turn it off for the slideshow, or go to the
Where?
slideshow.
Go to slideshow. Okay, thank you.
And then turn off use timing.
Wow, that's it? We got it now?
That should be it.
Oh, you're the best. Thank you so much. Because I know that was driving you nuts. Okay, so initially, mom is going to give you all her good stuff. You know, red blood cells carry iron. So of course, mom comes, you know, that's why we are full of iron. Now, as we start introducing food to these children, or even if we give formula, what do we give? We give iron fortified formula, or as we start feeding them cereals, it's iron fortified, because mom's cells have disappeared, their hemoglobin and hematocrit gotten lower, so they don't have that big supply. So as we get older, you'll see children start getting sick. Mom's defense has gone away, and you're going to start seeing those hemoglobin and hematocrits going down because mom's cells are going away and they haven't had a chance yet to make their own. Head growth, we know that there's fontanelles. There is the fontanelle, you know, posterior and anterior fontanelles, and they close at certain weeks or months. Now, the thing that why we need to know these things is, what if it doesn't close? Or what if it closes or doesn't close? These are things that need to be investigated by the pediatrician. It could be for nothing, or it could be something going on with the child. So it needs to be investigated. And when the baby's born, they don't see well. We know that black and white little things in front of them are okay. But as they start getting, their vision starts to go from one eye, looking at one eye, and there's no depth perception. Suddenly the eyes match up, and now they can reach and grab things. This is now, we're getting better with our ears. We can hear, but with our sight too. So a baby's going to be able to hear mom talking, you know, and cry, hey, mom, hey, whoa, I'm over here, and starts crying because they can hear, because their hearing is getting a lot better. As I said, when these children are born, they can't do to hardly anything. Their central nervous system is weak, and the muscles are weak, and, you know, transmitting those impulses. They have to learn what to do with their body. So we know that we start with raising our head. That's the first thing we do. Then we're going to roll from front to back and back to front. That should be finished about 6 months old. Then we're going to get up on our knees, and we usually sort of crawl a little bit backwards first. Then hopefully they get it forward. Then we're able to sit up without support. This is all muscles and your central nervous system working. Then we can pull ourselves up to our feet. We can cruise around a couch, a coffee table, or in mommy's arms, and then we start to walk. Now, we know that the system is very immature when they first start walking. You know, they're waddling back and forth and falling because their central nervous system isn't, you know, fully developed. But you're going to see about 2 years old, a child's able to run better, coordination better, depth perception. All of these things are better. And that's what that means about the nervous system. You know, I've talked a little bit about the immune system, about what mom is given to them, and that's a great thing. But we know that our own, even us, we're still building our immune system against what's out there, you know, in the population. You'll see infants put in daycare and all of a sudden start getting sick. And that's our immune system trying to build up those immune bodies and antibodies to protect ourselves. But in the beginning, it's mom. And if you're breastfed, that breast milk does give more maternal antibodies. That's why they say all babies should be breastfed to a year old, but not everybody breastfeeds, and that's okay. We do have the iron fortified formulas, which are also used. All right, that's about there. Now, thermoregulation. When a baby is born, they do not regulate their temperature. I talked a little bit about this last week too. So all this means for us is that we need to put this child under heat and have them wrapped in a blanket, a hat on, because they lose a lot of their heat in their heads, you know, as soon as possible. We don't want an infant to get cold because it can do a lot of different things to them. It could affect their GI, their bowels, and cause problems. So we know that infants are born and they're all full of this fluid. And then within the first couple of hours, they do get rid of it. If you've ever seen a baby, when the baby's born, it goes to the nursery. When it comes back 4 or 5 hours later, they even look thinner because they've urinated several times and they've gotten rid of that fluid. The kidneys are still immature when they're born, but we're still putting out good urine. So you need a minimum of 0.5 mLs of per kilogram per hour of urine. Babies, knowing that they're urinating, they should have at least 6 wet diapers a day. And then we know they're urinating. I know parents are like, but I don't know how many ounces they took. They're breastfeeding. I'm like, you don't need to know. As long as they're having wet diapers and they're 4 to 6, every 4 to 6 wet diapers a day, you're doing good. But usually it's closer to 6. When a baby is born, their GI system is very immature. That's why we don't feed them any food. That's why they either have breast milk or an iron fortified formula. No cereals or anything will be given because we could feed them, but what's going to happen? It's just going to come out with diarrhea. The baby cannot absorb it. It can't use it. So we don't make and stress that GI system. So if, for instance, sometimes we have to give a little bit of cereal to an infant, and that would be on an infant who has a little reflux. So we put a little cereal in their formula, or we feed them a little cereal before breastfeeding, because that will hold down the milk. You will see that in the stool because they do not absorb it, but it's used to thicken the formula or breast milk, and it helps keep the milk down so they're getting their nutrition. Now, we talked a little bit about fine motor, which is fingers. Remember, fine motor, F, think fingers. What do we do with our hands? Well, the first thing the baby does is grabs mommy's hand, and on reflex, not voluntarily, it grabs something, right? And I think that's pretty neat. Then it goes out and it will grab it, you know, spontaneously. You're going to see them grasping those things about 2 to 3 months. All of a sudden, about 7 months, they're going hand to hand. And then the difference of grasping goes to that little pincer. It starts crude with maybe a hand, maybe, you know, Cheerios on the high chair, swoosh in the face, but then it will go, they can pick up 1 or more at a time. Then it goes to removing objects from container, about 11 months old. And by 1 year, an infant should take 1 block and put it on top of another. And that's using hands, that's fine motor. So that's just a little quiz for you when you go and you look at this PowerPoint. Gross motor. Well, gross motor is all about, that central nervous system, making our bodies do something besides, be an infant that we have to completely support. So the first thing I said is head control. Now, if you see that baby to the right with a head going back, that is a head lag. That means you don't have control of your head yet. But as the baby gets older, if you go down on that side, you can see the head coming up as you pull. That's starting the head control. You're going to see different months for rolling over front to back to front. Front is abdomen to back or back to abdomen. But by 6 months, they should be able to roll all over the place. Now, why is that important for us to know? Well, again, it's a developmental level, but I'm going to teach the parents that at this age, you should never leave a baby on a changing table or on a couch because they're going to roll over right on the floor. And in South Florida, we have a lot of tile floors. So it would be a hard thunk. And then we're going to have a head injury and an emergency room visit. So making sure that we tell these parents, your child is very active now. Well, even as a newborn, they should never be on a changing table, not strapped in. We know that. But as they get older, we really need to reinforce that to the parents. Because parents tend to forget, not that they're bad parents, it's just they tend to forget or have to move quick and, take a chance. We know they should be sitting unsupported by 8 months old. That's always a question. Sitting, when do they sit? Oh, it's unsupported at 8 months old. And then it starts pulling up by 9. And then you can go from your back. And then this is a hard one. They're laying on their back. They can turn around or on their tummy. And all of a sudden now they can sit up. So they're from their back to their tummy, they're sitting up, they can pull themselves that way. It's a lot of coordination to be able to do that. So remember, gross motors get up and go. That's movement. Fine motor is fingers, all about what they do with their hands. You'll see questions on fine motor and on gross motor. Don't mix them up. I've given you the hint. F for fingers, fine. Nutrition, nutrition, nutrition. I think you've already heard this at least 10 times out of me, but you'll hear it at least about 100 times more. But the first 6 months of life, all they get is mom's breast milk or iron fortified formula because their GI system doesn't tolerate it. And we don't want to stress it. They do recommend a minimum 6 months of breastfeeding, but they really like it for up to a year. After 6 months is when we start to introduce foods. They'll start introducing cereals, iron fortified cereals, and fruits and vegetables, but they will wait 3 to 4 days in between every single introduction. So we just put in cereal, we wait 3 to 4 days, making sure this infant is not going to have an allergic reaction to it. Breastfeeding, they say 8 to 10 minutes on each breast. I mean, parents who have breastfed, you can feel the breast getting, empty and they switch it. And, it's not like you have to sit there on the clock. I mean, your breasts. So as I said, weight loss after birth, 10%. You could have a baby born at 7 pounds and now they're 6 pounds, 4 ounces. That's absolutely normal. As I said, I think of it as they're sitting in fluid, they're floating in amniotic fluid, and I believe they become like waterlogged. And then after delivery, what happens? They start urinating, they get rid of all that extracellular fluid, and that's what happens. So weight loss always, and then they gain weight. And then of course, they're saying 6 to 8 wet diapers, 6 is the magic number. But they're wet and they're going to say, well, it has stool. Well, you're going to feel them if they're nice and saturated. There is urine in there too. And they gain 15 grams, a half an ounce a day for at least the first 2 months. And today they believe in giving vitamin D. Vitamin D works on muscles. Okay, and that's the reason why vitamin D works on the muscles and the joints, and it helps the baby with their movement as they start all these gross motor activities. Nutrition, 6 months, the 6 months after, the second 6 months starts fruits, vegetables, grains, lentils, and you start to wean from the breast. Yes?
Oh.
Were you talking to me? Okay, that's her camera, her microphone. Okay, so which one do they choose first? I'm telling you, each physician, each pediatrician has their own thing, what they like to do. Okay, it could be one of them likes to start with fruits, one likes to start with their, rice or oats or one of those cereals. It doesn't matter. But the thing is, once they're eating these other foods, they're going to need less formula or less breast milk, which takes a little bit of pressure off of mom. So we need to have babies start having teeth, right? They say teeth should come up. I've seen them as early as 4 or 5 months come in. But for instance, it doesn't matter when they come in. It's just when they come, we should be starting just to brush them, soft toothbrush, or just a washcloth with a rag, just cleaning them to keep the sugar off their teeth, because they shouldn't be in bed with a bottle. So once they get to bed, you've cleaned their teeth, and now they're going to have good, healthy teeth. My children and my grandchild never had teeth by age 1. They got 8 at 15 months. It's just the way it was. And it's okay, because you could feel them there. We knew we had teeth, but we just had to wait. Again, all children are different. They do say it's the age of month of the child minus 6, and that's how many teeth they should have. So by 8 months, you should have 2 teeth. But if you don't, it doesn't matter, okay? Sleep, we know infants sleep a lot. This is the group that sleeps the most. They wake up, they eat, they're awake a little while, and then they're back to sleep. And what the literature says is you really don't need walkers and swings and playpens at this point. Just take them and, just put them back to bed. Now remember, it's on their backs. Infants who are put to sleep should be on their backs. It has been a research study that's been ongoing for many newborn intensive care units, especially, I know the one hospital I was working at is still continuing this SIDS follow-up about children going home, understanding going to sleep or naps on their back. And they have proven that the amount of SIDS deaths has decreased quite a lot. So back to sleep. Now, if you've looked at your book and you've looked at infants, you're going to see there's a whole bunch of immunizations. Well, what you need to know about immunizations is at birth, we're going to give hepatitis B. That's the first vaccination. That one you need to know. Then you need to understand that it's given at 2 months, 4 months, 6 months, a group of them, because we want to get that immune system built up against those really horrible diseases. We want them protected. And then as we get older, we give more, the mumps, the measles, the chicken pox. But a lot of these other can be given a lot early. HPV is given to your young adults, age 12. So understanding about how often they're given, the first immunization that's going to be given, okay, which is hepatitis B. Some things that can happen to infant, and I think it's probably a horrible thing to have, is an infant who has colic. This is a child that you can't get happy, who is full of gas, full of abdominal pain, and they cry and they cry and they cry. And, the parents have done everything to try to help. Even these children are put in swings, will do anything to have them to stop crying, because they're always kicking their legs, and that they're in pain, and it's from their tummy because you touch it and it's tense. It's a hard problem. It usually will go away by the first year of life, but it requires, many calls to the physician's office, many visits, many, going to the GI, going nutritionally, changing formulas, adding medicines. And it's just a very frustrating thing for the child. And of course, for the poor parent who's really not getting much sleep. There's something else that we call failure to thrive. And these are children who are not at the size that they should be. These children are children who, let's say, if they are having spit up, little, regurge, little spit up coming up. Well, sometimes that spit up becomes more than just a little. And what happens? They're getting rid of their nutrition, right? How would we know failure to thrive? Well, two different ways. They're not gaining weight or they're not meeting developmental milestones, because cognition and what they do, fine gross motor skills, is part of cognition, and they can't do it. And we know that it must be nutrition is the thing. Now, many times it's not just little spit up, it's something metabolic going on with these children. And I've seen children at 8 months old and they're only 9 pounds, and they've been to so many physicians and they don't know what's going on. And finally they just come, to the area pediatric hospital and come to the emergency room because they're just so frustrated with these children. So failure to thrive is a lack of nutrition, could be due to the way that they're fed, this sort of formula, could be a reflux, or it could be a metabolic condition. Some of the things that can happen with infants is they get a flat head, right? Especially today, only on their head, back to sleep. So many parents are complaining about the head being flat. I know that, when my grandson was an infant, he started getting a flat head. So just like I'm going to tell you today, what do you do if a parent, is telling you that? Well, when they're awake and really alert, position them on their belly and do tummy time. And that gets them off their back. And infants' heads are very soft. They're very pliable and they're very flexible, and they will round out. So they're not going to have a big flat head for life, okay? Another thing that they can do is if you have a really, really flattened head at one area. It could be because of, a really traumatic delivery and then subsequent hospitalization for a long time. And because of what was going on, they couldn't move their head and they're flat. Well, we can put these little helmets on them. Again, it protects them, keeps it rounded. And as I told you, these children's heads are very soft and pliable, and they will come back to that roundness which we want. Two other things that can happen is diaper dermatitis. And this could be the telltale sign that you're allergic to a formula or you didn't tolerate something mommy ate. So, or it could be just a new soap, or it could be, oh, you changed diapers. I mean, my infants and even my grandson my grandson liked Pampers. My children couldn't wear them. It's because that was what caused rashes. So, changing it and checking it out. So usually it's yeast. So we'll just put some nice statin cream on it. Moms will be told to leave it open to the air. Just wash with soap and water, pat it dry, and it will go away, and change them frequently so the urine doesn't burn it. The other thing is cradle cap. And we tell them today just to comb it with a soft comb or brush and wash it with soap and water, and it will go away. I just talked a little bit about SIDS. And we know that SIDS can happen for many different reasons. SIDS could be the kid just had a little cold, was sick, a little virus, or it could be a premature infant. Males are more than females with SIDS. Or it could be smoking in the house, or it could be those extra bumper pads and pillows and blankets and stuff in their crib and they smothered on them. And of course, it's when they're sleeping on their abdomens or even their sides, they should be put back to sleep. So that's, all of the things that you see with SIDS. Now, there's something else that we call an ALT, or an apparent life-threatening event. Usually, most of the times what I've seen with this, is you'll have a smaller infant and they have reflux, and it burns if you've ever had reflux or know anyone. And these infants arch their back and hold their breath and they'll turn blue. And the parent sees this and then, says, oh my God, they're not breathing, they're turning blue. And of course, rush them in to the doctors or emergency room, which they will be admitted to rule out this near-miss SIDS situation and to see if it is reflux so that we can treat them. Many of them will absolutely go home on an apnea monitor, and it's really easy to use. It's a Velcro strap that has two little probes on it. It goes over the nipple line and it looks at respiratory rate and heart rate. And there is a squelching sound that goes off when those alarm limits is above or below that. Jasmine, did you raise your hand?
So when my son was 2 to 3 months old, he was actually he actually had the near miss SIDS.
Okay.
They couldn't figure out anything that was wrong with him. He was premature, of course, but he was actually put on a ventilator, and they did every test they could, and they couldn't. So they couldn't figure it out. They had an endocrinologist come in. They had gastro. They had everything that they could and did every test, and there was nothing there. So the only thing they could do, say was near miss SIDS.
Did he go on after the monitor?
No, he eventually just kind of snapped out of it. Like he just woke up from his, I wouldn't say it's a coma, but I would say just out of his, he started fighting the machine and overbreathing the ventilator. So he was ready to come off. And so he just kind of snapped out of it. And we did like follow-ups with neurology and, you know, with respiratory, but he hadn't had anything ever since, but
Wow.
they had since they couldn't have a real diagnosis for him because nothing, he was unremarkable with everything. They just gave him this, and he coded on them when we first got to the
Wow.
ER. So he was a code blue, and he had the whole team come in and resuscitate him, but he's fine other than that now, and his autism.
I'm glad to hear that, we see these things and we don't know why, and the code blue. And so, I mean, if you were ever to become a peds nurse, you understand what the mother goes through. It's a frightening thing to watch. And I just hope you had somebody there holding your hand during that time. That's all I hope that you did.
It was a rough 2 weeks in the PICU. So not PICU. Yeah, PICU. I was going to say, yeah, the PICU.
Yeah,
so
you were 2 months. You're PICU.
He went NICU for 2 months and then PICU for 2 weeks. So literally right after each other.
Wow. Wow. Well, I'm glad he's okay, Jasmine. Thank you. Thank you for sharing. So Letitia is a breastfed infant being seen in a clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention? It's a 6-month-old sucking their thumb. Is this normal, or is this something you need to be concerned about?
C, that's normal.
It's absolutely normal. They suck their fingers, they suck their toes, they suck everything. And again, oral in children is self-soothing. So what she's doing is she's soothing herself. Now, I might say put a pacifier in instead, because as they get teeth, then the mouth will mold better for those teeth coming in, but there's nothing wrong with it for an infant to self-soothe themselves. So theorists, I gave you your list. You have them. I think it's pretty well explained in that handout. So again, make sure you review it. I'm going to go over some things regarding infants. Now, Erikson, what he says is there's children, it's trust versus mistrust. So infants need to develop a sense of trust. And what that means is I cry, I know somebody's going to come and get me, and I'm going to be fed, I'm going to be changed, I'm going to be burped. Whatever my needs are, I'm going to get it. That's what Erikson says. Now, mistrust happens when you have an infant who cries and cries and cries, and nobody comes to take care of them. So it comes to the point where they don't even cry because they know no matter what they do, nothing's going to happen. And that is mistrust. Okay, you can actually see if an infant's being neglected in a way just by the way that they respond to everyday needs. I'm hungry, I cry. I'm wet, I cry. If their child is just sitting there, just sucking their finger because they got nothing else and they're, dirty, there's something going on, and you can sort of tell. Now, Piaget talks about sensory motor, which means sense is what they touch. Oral is with their mouth, and then motor with their hands, what they can do, what they can feel, what they can touch. And initially, it's your reflexes, right? We have the palmar and we have the pincer reflexes. These are part of Piaget, what he says. After that point, we can take and we can move them around. And then at 4 to 8 months is where they start to imitate a lot more. You know, you look at an infant 4 months old, stick your tongue out, they're going to try to stick it out at you. You know, you sit there and you try to make noises. The infant is going to try it. It's just something that helps this infant start to learn and put 2 and 2 together. If I want to get a rattle, I can put my hand around it. You know, this is part of cognitive development. Seeing something, knowing how to get it, or seeing something and imitating it, or having a rattle, now starting shaking it. These are part of Piaget. We also talk about that object permanence, which we talked about a little bit last week. And this talks about, even though a toy is hidden, the infant who saw it knows it's still there. You put away the little boy's truck who's, 12 months old, and you put it in the toy box, you turn around, this infant's going to walk over there or crawl over there, open the toy box and get it, because he knows that even though it's not in sight, they still have it. They also start to learn about their body. They start to know about their feet, their hands. If they have a mirror, they can look at it and they know that it's them, and they start playing with their images in it. And that's why we should have mirrors for these infants. That's why you'll see a lot of car seats that have mirrors in front of it so they can watch themselves in the car seat. We know there's attachment. We know infants like certain people. That's not uncommon, whether it is mom, dad, grandma. And then there is a thing where you have an infant, a younger child, who's like 4 to 8 months, so they're aware of their surroundings. And you need to give that child to, let's say, the nurse, let's say to weigh them in the doctor's office. And that kid's going to try to turn around and grab mom and dad because they don't want to go, and they're going to start crying. That's part of separation anxiety. It's also part of stranger fear. You know, ever take a newborn into a daycare for the first time? You bring them in, they're 3, 4 months old, you bring them in, you leave, and you can hear them crying because they're used to mom and they're used to their surroundings. And stranger fear is, again, part of that separation, but there was other people that they don't know. And really about 9 months, they're so aware of their surroundings, they really know who they want to be with and who they don't want to be. We know language starts with crying and cooing on the infant. That's the first thing that they do. And we know as they get older, they're going to start to imitate. And hopefully they're saying dad, dad, mama by the end of the first year, because who are they going to say first? Is it mommy or daddy, right? We know they start to play, they start to entertain themselves. I think the first thing they do is play with their hands and feet, like I said. And there's ways that we can look at it through this questionnaire. If we need to, look at their temperament, see what's happening. So now we're going to go into the toddler. I call these the dive bomb children. The children that get on top of a couch and try to dive bomb off onto the other chair and miss it and fall and hit their heads. This is who they are. And I think it's a great time with children. It's the terrible twos, right? This is the one thing that we say. It's ages 12 months to 36 months, 1 to 3 years old, and they are exploring everything. And they're exploring their bodies, they're exploring their environment, everything in the mouth, everything. And they're playing with it and things in the air and pushing things, and their muscles are getting stronger, they're getting more coordinated, their eyes are seeing better, and they have all this depth perception, and they're saying no, 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 no. Mine, 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 mine. And I love this saying, having a 2-year-old is like having a blender without a lid. You really have to follow these children around because they are into everything. So at this time, when they're toddlers, they go on a slower weight gain, only 4 to 6 pounds a year. They're very slow. The height goes up, maybe about 3 inches, but the legs now are getting longer. Initially, the trunk on an infant is quite long. Then all of a sudden the legs grow. So now the legs are growing, not the trunk. We know that head circumference should be at least equal to, if not less than, the chest at this point. And at age 2, you realize that the infant is probably about 1/2 of their adult height. So double it is about how tall they're going to be. Their body systems get more and more mature. Their heart rate comes down. Their blood pressures are going up a little bit, almost into, the normal, like we call the adults, but still on a lower than the adults, but pretty close. You're going to see them now starting to be able to control their urine. They're going to control their stools. We know this is part of what they do. And, children love to become potty trained just to please mom and dad. They're pleasers at this age. They love to take the initiative to do what they need to do. That's, part of Erikson, their initiative. They want to go get their shoes to give them to you to put them on, or they want to try to put their shoes on, or they want to go get the diaper for their baby brother. I mean, these are the initiative. What is the guilt when we talk about Erikson? It's when parents don't allow them to try. We need to let children try to make mistakes or try to succeed and not tell them no. This is what that guilt is all about. So initiative, they're doing everything. Now, this is the age where they're more interacting between others. When they're infants, they're sort of not as mobile, but now they're mobile. They're up, they're moving, and they are now spreading their upper respiratory infections, tonsils. Remember, everything in the toy, as I call on the mouth, I call this age the swapping of spit in daycare and children. Everything in the mouth and on to the next kid, onto the next kid. And it's not a bad thing, actually, because what are they doing? They're building their immune systems. I just know that with, if you have children in daycare, which most people have to, let's be real here, people have to work. So these children, every week, every 2 weeks are getting sick, going to the doctor. But by the time they get to be school age, they're not going to be as sick. So as I said, gross and fine motor become better. They're able to run better without falling, walk better, not needing assistance. They can use both hands really well. And by 18 months, they should be able to throw a ball. I know my grandson whacked me on the side of the head. He did a straight shot, and some children are like that. And some it's right to the floor, but they can throw it. That's the important thing. As I said, their eyes are becoming better. Their depth perception is getting a lot better. They can reach out, find things. Their hearing, smell, and taste become a lot more refined. This is why children that are infants, you can feed them these things in formula. It smells terrible and you think tastes terrible, and they just gobble it up and think it's awesome, right? Well, toddlers, you can't do that. They become a lot more pickier. They only want certain things. I mean, I think it's the macaroni and cheese and chicken nuggets time, where that's what children want at that time, but only when they want it, okay? This is also a time what we call a physiologic anorexia. Toddlers don't eat. They don't eat a lot. And you'll see them eat quite a bit and then they'll stop. And then, and then they get taller. So they pudge up again, eat a lot, then they'll get taller and they get thinner. And this is just part of being a toddler. Again, they are exploring their environments. So as I said, autonomy versus shame and doubt. And, it's that guilt thing that goes on with parents. So autonomy, I can go out and I can do things for myself. And that shame and doubt is like, I don't know if I can because I'm not allowed to do that. So allowing children to do things are important. Again, it's no, 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 no. Now, they are starting to understand right and wrong. This id and ego, well, the id is your conscious. They know that if they take something, they're supposed to eat it and they go around and throw it in the garbage can, which could happen, they know they did wrong. Did you do that? Or did you color on the wall? And they know, I'm sorry. You know, if they understand they did wrong even before you talk to them about it. That's part of Erikson. Now, Piaget, again, is the sensory motor. This is pre-operational phase, and it's again starting to understand. These children like their rituals, okay? They like to be on when they wake up. Do they get dressed? They brush their teeth, they have breakfast, they play, they take a nap, they have lunch, they watch this show. They like those ritualizations, really important. Toddlers are hard to pull off of that. These ages 1 to 3 are hard to take on vacations because they like certain things, certain times. Now, Piaget now gets where they're using their mind. So ever see a kid in a high chair, mom goes in the kitchen to get something, they take their sippy cup and throw it on the floor. Well, why did they do that? They want mommy's attention. This is what Piaget is saying. They're tertiary circulatory reactions. They're experimenting. How can I get mom back over here, right? So this is a little bit more information here for you. Again, it tells you about the autonomy versus shame and doubt, and you can see what I was talking about. So you can go back and read about that. And again, the sensory or motor is when they throw it on the floor. Mom's going to come and get it for sure. Or let's say they have a rattle and, you know, mommy's going, go ahead, shake the rattle. Well, they'll shake it to get that, oh, aren't you so good? Oh, what a cool, playing with the baby, you know, and the baby likes those things. So it is, they'll do things to get that reaction. They're using their brains. How can I please? How can I please? How can I get what I want? I want mommy, I want daddy or grandma, whoever. Some of the things that's very, very normal with toddlers and every level of, you know, children is that they start exploring their genitalia. They're starting to look at, you know, you go in the bathroom, you know, and say, well, you don't have what I have. Or why does daddy stand and I sit? You know, or why do I stand and you sit? You know, and then it's understanding there is a penis and there is a vagina, and those things they're starting to understand. They're understanding there's boys and there's girls, okay? And this is usually about 3 years old, they get it. There's boys and girls and they're different. Now, they do tend to like rub things on their genitalia, you know, and it's a form of masturbation, but you shouldn't do anything to stop them. It's normal. I just ignore the behavior, walk away. If I was walking into a room and a child was doing that, I said, you know, I have to go do something. I'll be right back. Let them finish and come back. You're not going to make it seem like it was something bad. It's normal. As they get older, in toddlers, now they know the difference between people. They know that they have a mom and dad or a grandma, and we know that these people are other different. And they do go through stages of separation. You know, toddlers still want mom and dad there. They don't want to be left alone. You know, and initially they're screaming and yelling and going crazy. And by the time they realize mom and dad have to leave, but you know, all right, I've got to, this is what it is. And they stop crying and they actually go into almost grief, you know, sitting in the corner playing with themselves if they were like in a playroom area in a hospital, or they're just in the crib just playing with the toys that are in there. It's okay, well, it's what I have to do. Their social development, ages 1 to 3, you know, these children, even if they can't talk, they have a communication, you know, that we don't understand. They really understand each other. Another thing that you don't realize is toddlers, you can talk to them in a very simple way. It doesn't have to be baby talk. These children understand what you're trying to tell them. They're very smart, smarter than you think they are. Okay, they understand, they comprehend more. The other thing is they want to learn how to be that independent. Now, don't try to make things perfect. As I said, they're feeding themselves. It's going to go head to toe in their hair everywhere. Fine, give them a bath afterwards, wash them down, but they're trying. That's the point. when they are dressing themselves, let's say they're trying to potty train and they want to put on their own pants or shorts or whatever, let them try, even if it's backwards inside out. The issue is they're trying. That's what we want them to do. And the one thing I absolutely love is these children know when you aren't feeling well. For instance, I didn't feel well one day and I was, crying. I already have pain and I hurt. I needed some ice. And my little grandson, I think he was 2, came over, just gave me a hug, and he just kissed me where it hurt. It's that feeling, and you'll see infants this young, these toddlers, that will do those sort of things. As again, I've talked about play. Play is so important. Play is what builds cognition. It is what, whether it's alone, whether it's next to another child, whether it's doing what somebody else is doing, or playing a game like checkers, cooperative play, where they both doing the same toy, the same playing, and there is a goal. There is somebody who can win, or a house is built when you're done, or something like that, okay? Toilet training. We know that some children potty train before others, and that's okay. It doesn't mean you have to be potty trained by, age 3. It's every child is different, okay? Sibling rivalry is always part of it, especially if you're the only child and all of a sudden you have a new baby infant sister in the house, and all of the attention's going to her. Always, as I tell parents, just make the kid be a part of it. Have them go get a diaper for you. Have them go get a tissue. Go have them get a blankie. Show them where things are so that you can be the big brother helper or the big sister helper. And it really helps with sibling rivalry. Temper tantrums are something that can happen anywhere, anytime. I used to hate when it happened in the grocery store and they slam themselves on the ground and they're laying down, and because they want something and you're not paying them attention because you can't buy everything in the store. So how do you deal with that? Well, I walk away as long as they're doing nothing to hurt themselves. If they're doing something that could inflict harm, I'll intervene. But if they're having a temper tantrum, just ignore the behavior and keep going, okay? Again, they're no, 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 me do, mine, 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 mine. It's all about what they believe. It's all for me, okay? And there are times where children, usually when they get sick, you'll see them regress. You'll see a child get a fever, not feeling well, all of a sudden the thumb goes back in their mouth. Or you will see something happen in their life, maybe mommy and daddy split up. Let me tell you, these children do know it. And maybe they want to go back to drinking the bottle instead of a sippy cup. These things happen, or they want their old blankie they had when they were an infant. These things happen. It's regression. So here's all your gross motor things that you can go back and you can look at, okay? It's part of you. So social development, we know that by age 1, a child should know mommy, daddy, something, a 1-word sentence. By age 2, the child can ask more, like apple juice, or go outside, or go out, little things. And then they start to build upon that. They're going to be feeding themselves, playing by themselves, trying to dress, and of course, trying to undress, and you should allow them. And of course, we know play is so important, and making sure they have good toys. And then we're going to go on to your preschoolers. Now, your preschoolers, ages 3 to 5. These children are starting to go to school, many of them, preschool. And it is a big change. I mean, when you're in a daycare, or maybe you didn't have to go to daycare, you stayed home, now you have to work with a group of other children and sharing. And that's the big thing, sharing and communicating and listening and following rules. You're going to have an increased attention span and memory. And these are important. It's that preparation to go to kindergarten. They still get bigger, taller. It's still not fast. 5 pounds a year, 2.5 to 3 inches. Again, these children, their body systems are again changing, maturing, but preschoolers can adjust to stress a lot better than toddlers. Like toddlers need the rituals. They need certain things done certain times, the way they do it every single day. Preschoolers, it's not as bad. They can, as long as you explain what's going on, they can adjust a lot easier. They're walking, running, climbing, jumping like crazy. It scares me what some things that they do. Sometimes I have to turn my head. Fine motor, again, it's starting that eye to hand to muscle. That's drawing, that's being able to draw, getting closer to inside the lines, drawing letters, starting to get neater and neater as they get older. They're starting to dress. It's, again, it might be backwards, but it's almost right now. They're doing so much better, with their fingers, with getting dressed. Erikson is all about feeling guilty, anxious, and having fear because they don't want to do something that isn't right. They are pleasers, okay? They learn there's right and there's wrong. Now, this is wrong things and things you shouldn't do. It's a little different from Kohlberg. Now, Kohlberg says that there's right and there's wrong and there's a consequence for both, okay? Erikson just talks about they know that if they do something that it was right or if it was wrong. As I said, preschoolers are getting ready to go to school. They're ready to start to learn their alphabet. Piaget starts talking about understanding that there are all sorts of people now. There are understanding that there's all colors of people. There's all languages. People speak everything, dress differently. And they're starting to understand other children, other people that are different from them. And they're starting to ask questions about that. So they're able to express themselves with words so much easier. As a toddler, I couldn't understand so many times what was said because the speech was garbled. But as they get older, you can hear more and more and more. They're also, children at this age still don't read a clock. They don't know 4 o'clock. What they know is after we come in from the playground, your mommy will pick you up in the afternoon. Or you can stay here for 2 morning times. That's what I used to tell my grandson. He'd come over for Friday and Saturday night. I said, you're here for 2 morning times. So he knew he'd go to sleep and wake up 2 morning times, and he knew that's how long he'd be there. So they don't understand time completely. They just understand the events that are involved with it. And the other thing is they know when they do wrong, something's going to happen. Are they going to be on timeout or something's going to be taken away? As I said, Kohlberg is right and wrong and a consequence for either. If I do something wrong, I'm going to be punished. But if I do something right, I'm going to be praised. So many of these children will want to do things right because they want to have that praise. They are starting a strong attachment to the opposite sex parent. My grandson and me are going to be BFFs forever. He absolutely thinks I am the cat's eye, but I was with him the first years of life. Now, he's also that close to his mother, and his mother is that person, the opposite sex. Now, girls like daddies and boys like mommies, and that's just normal. Just absolutely normal. They are starting to become, if they're getting undressed for a shower, don't look. Or if they're going to bathroom, it's like, don't look at me. They don't want other people to see them. Before it didn't matter, but now it's starting to make a difference. They are knowing that there are differences in boy and girl, and that mommy and daddy dress differently, etc. They're starting to learn. They're also starting, again, playing with themselves, knowing the differences there. And now they're asking questions like, where do babies come from? These are your preschoolers. So again, that ritualism that you need to have on a child who is a toddler, and that no, 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 me from toddlerhood is gone. They don't do that anymore. They can dress themselves. And as I said, they love to please. They love to please. And now they are learning, about Christmas. They're remembering last year's Christmas. They understand, the values that you bring. Is it all about the tree and presents, or is it all about going to church and Jesus? I mean, every family is different. Or is it all about Hanukkah or Kwanzaa or whatever the name of it is of the culture that you are a part of? They're starting to learn what that stuff is. But they're also going to test you. They're going to say, well, bedtime is now. No, I need 10 more minutes. They're going to test you, test you, test you, test you. They want to see what they can get away with. Now, if you see that little boy at 4 years old, fine motor, you should be able to button your shirt. Again, the play. You're going to see this the whole way through, okay? Associative, imitative, imaginative, dramatic, mutual. These things build the cognition and makes the children think. It helps them put 2 and 2 together and get a 4. Whereas before they just played and didn't understand outcomes of their playing. Preschoolers are afraid of the dark. They have to have all the lights on, or they don't want you to go in that room without you. They do not want to be alone. Let's say they're in the house and you went outside and all of a sudden you hear them screaming because they want to see somebody. They don't like to be alone, whether it's daytime or nighttime, that don't matter. They're afraid of dogs, yappy dogs. They're afraid, especially the dog, the big dogs. They're afraid of them, or any large animal. They're afraid of ghosts. Where they get them from, I don't know. But I just went through that with my grandson. He just turned 5. So I just went through that. Where did you figure ghosts out? I said, when you find a ghost, could you call me so I can introduce myself? So that sort of got him over those fears. And as a 5-year-old, he's not afraid anymore of many of these things. They're afraid of their body parts being destroyed. That castration, they are, it's part of it. And they're also afraid of people associated with pain. And guess who that is? The nurses. We give those injections, those immunizations, right? That's why we need to do those atraumatic things with these children so they have the least pain possible with any treatment that we do. When we're talking preschoolers and sex education, we need to know, what do they know? And it sort of lets them express things, and then it brings up questions and you can answer them in words that the child will understand. Again, they say today, it's not these other words that are out there. It should be a penis and a vagina, but every parent's different in calling their body parts whatever. I mean, my grandson knows a penis and vagina. We have different things, and that's it. There's not a big deal about it. Be honest with what you're saying it about. I mean, but remember, these children are preschoolers. They're up to the age 3 and 4. And again, masturbation again. If they're doing it, say, hey, go do that by yourself in the other room. I don't need to see that. So that they know it's not wrong, but it doesn't need to be around people, okay? Again, those are your things with the fears. So let's go to our Kahoots. It's a long one today, but it's got some great questions on it for you. Any questions? I love these groups of children. I think that they're the most fun. Watching them develop is the best. And I'm just grateful I just had that opportunity with my little grandson. And everybody gets that. Did everybody have a chance to go to the YouTube site and able to look at the Kahoots from last week? Okay, well, it is there. And I've also given you the pin for it, the link, so you can go there. Again, remember, these Kahoots are so important. It covers the concepts that you are going to see moving forward in your exams and your HESI, and then in the future, your NCLEX. It's a great review before you take your NCLEX when you get there, because I'm sure all of you will. You've worked hard to get here. All right, let's get going. Infant, toddler, preschooler. Excuse me. Which factor predisposes toddlers to frequent infections like ear infections, tonsils, and upper respiratory infections? Remember, these are the children that swap spit, that this goes on in toddlers. And again, it does build up their immune system, getting prepared as they go forward and before they get into kindergarten, which is important. But they have little short, little straight eustachian tubes. They've got huge adenoids and tonsils in there, and it holds the mucus there. And that is why you will see them in frequent infections, okay? Their defenses are less efficient than infancy. No, actually it's more efficient because they've probably had colds already or something, okay? So the answer is because of the way that it's built, the anatomy. What type of play is considered cooperative play? That's supposed to be a race car. I did that quick. So when you look up the definition for cooperative play, what it is you are playing with another child, but not, that's associative play, okay? Just playing with another child. But there is somebody who wins, or there's a goal. You have built blocks together, you built a house. When you're done, the house is done. So playing checkers, they are playing together, but somebody wins. There's a goal to the game, okay? Do you understand that? Does that make it easier? According to Kohlberg, pre-conventional level of moral development, a preschooler who has moral reason, what? What did I tell you about Kohlberg? So Kohlberg, if there's good, there's bad, there's right, there's wrong, and there's a consequence for either. Excellent, good job. Which nursing action is appropriate to teach a preschooler about a scheduled procedure? So you have a child ages 3 to 4. How are you going to teach a child about, let's say, having an x-ray, or maybe going for a CAT scan, or having some sort of surgery? How are you going to teach them? And you're going to use a doll. And then, of course, you're going to let them touch and feel any of the instruments that are there. This makes those things less dangerous. It's like they know what they are, what they feel like, and they're not going to be so scary anymore. Multi-select. Some of findings from a pediatric physical assessment. Which of these are about physical? So growth and their body systems, you can touch, you can listen to. The other ones are history. They're just history. What was the symptoms, or what was the family? So physical is what you can touch and what you can see and what you can hear, okay? Good. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? Again, a toddler is ages 1 to 3. And I need to go in and take a blood pressure. How am I going to get that done without a kid screaming and yelling and be totally stressed out? I'm going to let them play with it. I'm going to have them push the button to take the blood pressure, right? Those things, just taking a couple minutes saves you so much time when you're working in pediatrics. What would you suspect if you note that an infant's chin is quivering, their fists are clenched, and they're inconsolable? That's all part of the Flack scale. Their faces, their legs, their activity, they're crying, right? Their fists are clenched and the chin is quivering. That is all about pain, okay? That is a telltale sign. And when you have a child who's crying and you can't console them, you know that they're in pain, okay? That's probably the biggest word there that showed you it was pain. A multi-select. Erikson describes infants as trust versus mistrust. What does trust mean? So you're going to see a child's going to feel secure. They know when they cry, mommy's coming. They predict what's coming. Their needs are met because they cried, and it always happens. And this child's going to be your calmer, happier baby. Good. A 3-year-old is having an outpatient procedure. How would you help this child to be less fearful? And you're going to use that doll again, and you're going to let them know what's going on and touch that equipment, and then you're going to have a happier kid. You need to do an assessment on an infant, and you walk into the room and that infant's asleep in the mother's arms. What are you going to do? This is the absolutely perfect time to look at their respiratory status, because infants, when they're in distress, you'll see their little nares flaring. Also, if they're in severe respiratory distress, you might even hear a little or a grunt at the end of each breath. You take your breath and it's and then they're flaring nasally, and of course, abdominal breathing, and it will have retractions, but it's a great time. You can also listen to a heart then too, because they're not crying, they're not moving. So take advantage of the moment. When do you switch formula to whole milk? Well, we talked about when we can start adding food, but when can we start whole milk? Remember, I've told you that they want to have breast milk for at least the first year. It's because at 1 year, they tell you to switch over to whole milk. I mean, many people are breastfeeding go on for a year or more, but you can switch to whole milk at that 1 year. Before assessing a 4-year-old child, what techniques would you use to approach this child? Now, this child's 4 years old. They're smarter, they're more alert, they're aware of their surroundings. They know that nurses come in and have been giving them shots. All they do is things that hurt. And the best thing is to take the attention away from what's going on, okay? Don't tell them what's going on, rewards, it's not really needed. What you do is say, you got cute curls. Oh, look at those freckles. Where'd you get those blue eyes? Or even a 4-year-old, Are you in school? What do you like doing in school? Do you like your alphabet? What color do you like? Oh, that Batman shirt's pretty cool. Take the attention away. And when you do that now, you are less threatening. Don't go in and try to touch that kid immediately. It's not going to happen. Go in there and get the kid calm, knowing that now you're an ally. You're not there to hurt them. Now you seem pretty cool. I mean, you can offer them stickers in the end, but it's how you start it. What technique can be used to examine a toddler? Toddler, ages 1 to 3. So absolutely, we're going to use play. Perfect. I don't even have to explain that. Excellent. When assessing a healthy baby's lymph nodes, what should you expect? So you're feeling those lymph nodes if you're not tickling them. What should you feel? Or not? A healthy baby, you should not be able to feel lymph nodes at all. Those lymph nodes become swollen when they're ill with an infection. So normally, no lymph node should be felt, okay? If there is, there's a problem. Which Erikson stage of development levels would be used for a toddler? Remember, toddlers like to be able to do things by themselves, and they don't want anybody to hold them back. Let them try. Let them make those mistakes. And there we go. Autonomy versus shame and doubt. That shame and doubt is I can't do it because I don't know if I can because nobody let me try. A multi-select. Erikson's autonomy versus shame and doubt to use to describe toddlers. What does doubt mean? Shame and doubt. So we know that this autonomy is being able to do things for themselves. So they can do things by themselves. They're allowed to try new things, but that shame comes in when, you know, they're not allowed to try. So those are the 3 different things you'd see here. I mean, toddlers can play by themselves, so can infants. That has nothing to do with what Erikson says. When walking into an exam room, you see a 2-year-old rubbing a stuffed animal on their pubic area. What is your intervention? What do you do? Remember, toddlers are in that self-exploration stage. Toddlers, preschoolers, school age, all of them. It's just part of normal human experience. So let them continue, walk out, say, I'll be right back. I forgot something, and come back. Do not bring attention to it, especially the toddler. Preschooler, you might say, if you want to do that, go by yourself, go in your room by yourself. You don't need to do it here. A parent of an 18-month-old boy said he says no, 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 no to everything and has rapid mood swings. Is that right? Is that wrong? Why? And it's absolutely normal. That is a toddler. That's them in a nutshell. What is descriptive of a preschooler's understanding of time? Do they understand time? So time is understood with events. After your nap, your mom will get you. Tomorrow when the sun comes up, we are leaving on vacation. Whatever it is an event. And they understand that. They don't understand the clock yet. I'll multi-select. How do you place a toddler on timeout? You know, so toddlers are very headstrong, and we do know that, but they do things that require times out. You know, they hit their brother, bit their brother, whatever. So it's 1 minute per age. You need to explain to them why they're on timeout and that what are the rules when they're on timeout. When you are quiet, you'll need to sit there or we will restart. We can't start the minute or 2 minutes until you are quiet and you're sitting down. So after they're sitting down, you start the clock 1 minute and they understand, and that's what you should do. I mean, I had a sister-in-law, a daughter-in-law who said that, I mean, 100 times a day to her 2 boys. I'm like, I don't think they get it at this point. You said it too many times. A 1-month-old's infant's back of their head is flat. What would you tell the mother? Of course it's flat. They've been back to sleep. She's been doing it good, putting them to sleep on their back, which they should be. But how can you calm this mother down and let her know that the head's not going to continue to be flat? Because that's what she's worried about. So when the kid's awake and alert, then you'll put them on their tummy, and then they will get the back of their head really rounded out. And in severe cases, we can put on one of those helmets on those children. An infant crawl before they walk. The pattern of growth and development is called what? They lift their head before they roll over front to back to front. And then they're going to start crawling on their knees. Then they start up on their feet and they start cruising and walking. What is that called? And it's in a sequence. So this is sequential trends. This is things you see in growth and development in the sequence. It doesn't mean they have to go every step. Some of them, children skip some steps. They may just go from crawling to standing to running, but they go through it forward that way. How do you communicate with parents that do not speak a language that you know? So you have a patient come in, I mean, here in South Florida, there's many, could be Haitian parents, it could be Spanish parents, and you need to communicate. You need to know allergies, what's going on, et cetera, et cetera. So you're not going to have an adolescent or family member try to do the interpretation. And because they put in their own feelings in what they're interpreting. If you use those telephone interpreters, it's verbatim, word by word, what they're saying, because you don't want anybody else's feelings in it. You only want exactly what was said, okay? So always use those interpreter phones, unless there's somebody on staff that speaks that language. What age would most children could understand under, on top of, beside of, around, and back of, over, under? Now remember, if you have children, forget all of the things your children did. You have to remember what the book here says. I know that my grandson was doing this at ages 2.5, maybe even 3. Okay, and this says 4 years old, but they should, at age 4, all children should be able to, most of them should be able to understand over on top of, around of. So again, if you have children, forget you have them. I think students who have 4 or 5 children, you think you know everything about the child. Remember, it's not about what your kids did, it's what the book says, okay? I think that's the hardest thing in pediatrics, having children. In terms of language and cognitive development, a 4-year-old should be expected to what? Cognitive and development, the way they think, the way they understand. And they should be able to follow a command. Take your plate and put it on the kitchen counter. Put your shoes by the door. Take your clothes, put it in the dirty laundry. They should able to know simple commands. How would you assess the pain on a toddler? Ages 1 to 3. What are you going to do to assess pain? And 1 to 3 is still the Flack scale. It becomes faces at age 4, okay? So be 3, 4. So 1 and 2, these are going to be Flack. And then when you get out of toddler, get into preschoolers, then it's faces. A multi-select. What safety instructions would you teach the parents of a 6-month-old child? Safety instructions. Well, what developmentally should a 6-month-old child be able to do? And if we look at those developmental stages, these children should be able to roll over completely, right? So we are going to make sure that they're not anywhere on a couch or on their changing table. They should be safely placed there. Of course, car seat is rear facing, and those electrical outlets should be covered because at 6 months, they're starting to move a little bit and start looking for those outlets and sticking their fingers in them, getting inquisitive. A nurse receives a phone call about a 6-week-old baby. He's crying a lot every day. What can she do? Now, if you were told a 6-week-old baby was crying a lot, can you tell her something on a phone? So this infant needs to come in for more evaluation. They need to be looked at and examined by the physician because, you know, it could be colic, maybe it needs medicine, or it could be something more dangerous. So we really need to evaluate it with a physician, urgent care, or ER if you need to. A multi-select. What should an infant be able to do at 9 months old? And be careful as you're reading these things. They should be able to sit unsupported. They don't need support. Yes, they can voluntarily get that rattle now, and they should be able to get up on their feet. And we just went over it, should be able to roll over completely at 6 months. The first expected fine motor developmental milestone for an infant begins with which one? First expected fine motor. And it's that reflex. Excellent. Good job. Which statement about toilet training is correct? So the biggest thing about toilet training is toddlers want to please their parents, and that's what motivates them the most. When you look at, yes, bladder is before bowel, but okay, I probably could put that one as a correct answer too. I think you're right. I'll change it. But it's all about that motivation of the parents. They want them to say, oh, you did such a good job, right? Kohlberg, a good outcome, a good thing is a good consequence, right? They want that stroke, that, yeah, good job. A toddler's parents ask the nurse for suggestions on dealing with temper tantrums. What do? Middle of the grocery store, lays down, screams. Little 2-year-old. Come on, let's go. Get up. Again, ignore it, okay? Just absolutely ignore it as long as it's not going to cause them any injury, okay? Because then they realize they can't just do it. They're not getting the attention they want, so why do it again? A 2-year-old has difficulty in activity, sensory sensitivity, and has only spoke one-word responses. Assess with what sort of tool? Now, in your book, there are some things on assessing children, and there are children that they're very difficult to assess. In this case, this is your autistic child. When you talk about 2-year-old, they should be more than one-word phrases. And they don't like scents. They don't like lights. They don't like noise. They don't want you to touch them. So the way we would take and evaluate them is with this modified checklist for autism toddlers. It's the only way we can, because they are different and they do different things at different times. And it depends on early intervention. I've seen children, autistic Downs, by the way, who literally loves to be hugged and loves to be a part of things, but has his times alone playing by himself, doing these repetitive acts. So depends, early intervention, but we can evaluate it with this checklist and get them into early intervention. Parents are concerned her 8-month-old is not developing like her older child. What is normal for 8 months? I mean, things happen so quickly in the first year, but the thing about 8 months is sitting alone unsupported. That's what you see. 9 months old, they're pulling themselves up. What fine motor skill is expected of a 4-year-old? Fine fingers. And that's, they should be able to button their shirt. Those are fine motor skills. Very good. I think tying their shoelaces is by 5. Skipping using alternate feet. This is now gross motor, and then walking. Those are gross motor. A multi-select. What gross motor skills should a 4-year-old be able to do? So we went to fine, now we're going to gross. So at age 4, they should be able to walk upstairs 1 foot after the other, okay? Because initially it's just 1 foot, 1 foot, 1 foot, and they should be able to hop on 1 foot. Jumping rope is age 6, and I believe the shoes are 5. Car seats can be safely switched to the forward-facing position at what age? And I had to do research. It doesn't matter the amount that the child weighs, it's the age, because it has to do on muscle development. And it's 2 years old is when you switch it to front. So I said, remember, my grandson was 21 pounds for a year. I think he was 22 pounds by the age he became 2. So he gained a pound. But they were not worried about it because the kid was in every other developmental level stage just fine. But then I was like, well, he's only weighing 22 pounds, can I? Because most of the cars say a different weight, but it is the age because of motor development, not the weight. The second expected fine motor developmental milestone for an infant begins with which? Fine motor again, fingers, fine. So it starts out with a reflex and it goes to voluntary. Very good. Pincer is not till 7 months, 10 months for a neat pincer grasp. And things in the container is about 11 months old. And Jamie's on fire. RN doing a developmental screen on a 10-month-old should expect which fine motor skills from this infant? Fine motor. What should absolutely they be able to do? So they should be able to voluntarily get a rattle, and they could go hand to hand here. And now they're using that pincer grasp, which is either a little bit of crude or even a little bit finer, but absolutely they should do these. Putting objects in container is 11 months old, and building a block of 2 is 12 months old. Frequent developmental assessments are important for which reason? Why do we do these? Why do we look for these things in children? Can they roll over? Can they sit up? Can they use their fingers? Or why do we need to know that stuff? Because we can find out if there's delays going on. And why do we want to know that? So we can institute early intervention. We can catch children up so quickly. They're so smart, they're so special and unique that they do. We can catch them up quicker than you can think. Multi-select. An infant searches for her toy that's not in sight. What is that called? She knows it's there, but it's not in sight. And that is what we call, number one, the big word is object permanence. But this is an infant doing things without anybody there, which is very important. That's cognition. And then the cognition is memory developing. Seeing the little whatever rattle, knowing it's there. It's not in sight, but let's go looking for it. So all of these things are important. And this promotes good cognition. The natural physical developmental sequence that most children follow is what? What do we start with? I've said it a few times today. And we lift our head first. So that was the only one that started there. Roll over, creep, crawl, cruise, and walk. Absolutely. And again, you might go from crawling to walking, and that's okay. And you might go from creeping to cruising, and that's okay, as long as you're going forward in that developmental level. A multi-select. Which would alert the nurse to hold digoxin on an infant she is caring for? Well, what do you know about digoxin with adults? It's the same thing as children. But the only difference is we have different heart rates on infants, right? That's why we need to know what our vital signs are for which stages of a child that you're working with. So if the heart rate is 90, that's too low, because an infant is what? 140 to 160. We know the potassium level has to be in normal, and a digoxin level of 3.3 is dig toxic. Bounding peripheral pulses have nothing to do with giving dig, okay? We look at potassium levels, we look at heart rate, and we look at dig levels. So very good. And in general, an infant should triple their birth weight at what months of age? And that should be at 1 year, 12 months. We double it at 6 months, triple at 1 year, 12 months. When an infant's toes spread, when the palms of the feet are stroked, What reflex is that? What is it called? So just like adults, as Babinski, rooting, stroking the cheek, going forward to eat, whether breast or a bottle. Startle is when you make a loud noise and you'll see the hands come up and the legs raised, and the grasping we've already discussed. You have voluntary and reflex. When entering an infant's room, the door slams shut and the infant jerks and starts to cry. What is that reflex called? It's called Moro or startle reflex. That is some of the reflexes that you will see mentioned. And the kid, you'll see you bounce their isolette or their little crib they're in, and you'll see them jump, their hands splay out just like that. A 4-year-old's reluctant to take medicine. What intervention should the nurse take? 4-year-olds, if they don't want something, it's going to be difficult. And what we need to do is do a straightforward approach. Would you like it in a cup, a spoon, or syringe? Which one would you like? We never, ever, ever mix medicine in food or juice because we do not know what if they don't take the whole thing. How much do they get? Okay, so we need to know the dosages on them. So we do not put that in food unless it's the stuff in a little food and they take the whole thing, but never in a bottle, never do those things, okay? So using a straightforward, how would you like to take it? Do you want the red one or the orange one, like Tylenol or Motrin? So give that straightforward. Only give them choices and have them make a choice. Which intervention helps a hospitalized toddler feel a sense of control? What do we know about toddlers? What do they like? What makes them feel good? That's their sense of control. And remember, toddlers are rituals. They love rituals. Very good. Yes, same routines, keep feedings, everything the same. And Art assessing a 2.5-year-old toddler, what findings should she report to the provider? What's not right? When you're reporting to the provider, something's not right. Something's not good here. Which one of these isn't good? And the head should not be bigger than the chest at this point. It should be equal to or less than. And if it's bigger than, there's something wrong. Is there a brain tumor, hydrocephalus? Something's going on. A multi-select. What are risk factors for SIDS? So males are more than females. So that's a risk factor. Smoke, absolutely. A recent viral infection, all those threes are risks for maybe having SIDS. If you're breastfeeding, they say breastfed babies have less chance of SIDS. So absolutely not breastfeeding. That's a good thing. Prevents it. What does the rooting reflex enable the infant to do? Rooting, stroking them on their cheek. And that's, they're getting ready to eat. You're making them hungry. They go look for it and they want to suck. Good. A multi-select. A child has been admitted with profuse diarrhea. what would you expect to see here? Now, one of the things I noticed on the HESI, they're putting a lot more acid-based questions. So in your Kahoots, I give you acid-based questions. So what do you know about diarrhea and what it causes? And it's, of course, you're going to lose potassium, and it causes metabolic alkalosis, okay? So these are things that you are going to see in these children. An infant's unable to take the breast or a bottle for feeding. What should you remember to do? You know, they're in a condition where they can't eat for many reasons, respiratory status, but you still got to promote growth and development. What's one thing that they do need? Remember, infants do relieve their own stress and they know how to calm themselves down. And if they're not giving an opportunity, that you're going behind on growth and development. So giving them a non-nutritive sucking or a pacifier does help. Now, there are conditions that you can't put anything in their mouth because let's say the mouth is open only to the lungs and the esophagus doesn't go the whole way down. What you're doing is you're promoting aspiration into the lungs, right? So if you can't, pacifier. What does an infant start to do at 3 months? At 3 months, we know they're rolling. So again, safety, being careful with them, teaching parents is so important. And your last question, guys. The infant's first form of communication is what? What do? How do they get your attention? And yes, they're going to cry and they're going to coo. Absolutely. Let's see how we did today. Number 3, Jasmine. Good job, Jasmine. Number 2, Jamie. And number 1, doop, 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 doop. Lauren. Good job, Lauren. Number 4, Quenisha and Jess. Good job, guys. It was a long one, but there's so many concepts when you're talking about children that we really needed to go over them. So I appreciate your patience. I want you to sign your attestations, please. Get those done. Don't forget them. You've all been in class. You all can sign them now, okay? Any questions at all? Your first quiz is open.
I have a question.
Yes.
I have a question about like our discussion post.
Yes.
I saw that you graded mine, but it said that I didn't cite, but I use like, do we have to just use our books or we can use something?
Okay, no. The cite is when you put those quotations in the middle of what you're saying. And I put the Perry, comma, 2018 in parentheses.
Okay.
That shows me that it came from there. Even if you put one down, it's just a proper thing to get used to as you're doing these posts. A common mistake for many of the students today.
Okay, awesome. Thank you.
Yes, you're very welcome. Who needed to see me afterwards? Okay, everybody, thank you so much. Any questions, again, let me know. I'm here and I'm available for you.